Mr. Brown.
Good morning, Brother Brown. How are you doing?
Right, we're doing fine here. We're doing just fine,
Good deal.
and
Excellent. Excellent.
I hope you're doing the same.
Yes, I am. Yes, I am. I'm doing good. I'm doing well.
Okay, we're ready for health facts. It's 10 o'clock.
All right, let's do it.
We're ready for health facts with Dr. Christopher Brown. Dr. Brown, you're on the air.
All right. Thank you, Brother Brown. Thank you, Brother Brown. Always good to chat with you. Good morning, listeners. You're locked into WVOE, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of Pressure MD, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. So what's our topic going to be today? So recently I had the experience of staying in the hospital with a loved one. And of course, as a doctor, I typically go to the hospital to see patients and, see them, make orders. And of course, after finishing what we call our rounds, I usually leave the hospital. But this time I actually stayed with the loved one that was in the hospital. So, all day long throughout the day. So got to see a different side of hospital. So, one of the things that, that I was able to notice is that there are things that, things that went well, things that didn't go well. But it crossed my mind that, maybe today's show could be, staying safe while in the hospital. There have been articles before and even, little shows talking about the things that can go wrong while inside the hospital. And of course, I got a chance to see some of those things. And but there are ways for you, like everything else, there are ways for you to, kind of minimize the chances of those things happening to you. When I talk about this, a lot of people say, oh, you're kind of blaming, whether it's nurses, doctors, the hospital itself. But we always have to remember that these things are made of people. And of course, people are flawed. We try to create systems in order to minimize the chance of anything going wrong and to maximize your safety. But of course, there's always a chance that, that things may not go as well as they should. And so what I'm going to talk about is a little bit about, this whole concept and how you can, be an advocate for yourself or for your loved ones to make sure that they stay safe while in the hospital, Okay. So I think probably the biggest thing to think about is, what is, what we call hospitalization or inpatient hospitalization, because in healthcare, there are two big arenas where we practice medicine. One is what we call outpatient, and one is called inpatient. Outpatient is whenever you're seeing, when you're seeing your regular docs, going to the clinics, going to the medical practices and stuff of the nature, the clinics. That's what we call outpatient. So it's where you kind of go in, have an appointment, and then you leave and go home. You may be getting labs or imaging and stuff of the nature, but it's all on an outpatient basis. Well, if you get really, really sick, then you get what we call admitted to the hospital. And that's what we call, inpatient practice of medicine. So you're in the hospital and like I said, you stay there. And like I said, we take care of you there. So, so this is, and pretty much you're getting round the clock care. Like I said, there's always somebody on what we call on call. So there's there's the nursing staff, there's a doctor staff, but while you're in that hospital, you're somebody is responsible for your care and someone is taking care of you around the clock. And it's usually, of course, for serious conditions that require constant monitoring or constant treatment. So that's what inpatient is. So what kind of conditions or what qualifies for what we call hospital admission? Now, one thing to be aware of is, when you get into the hospital, there's usually two main ways that you get into the hospital. So the most common way these days is really what we call is going through the ER. So someone is saying, you'll either have a condition or someone says, hey, you need to go to the emergency room. And so in the emergency room, they decide, whether or not basically if you're sick enough to qualify for going inside the hospital or if you're stable enough to be managed on the outpatient side. So, if you come in and you got some chest pain and you have a history of heart disease, that would qualify for, most of the time that's going to qualify for a hospital admission. And so you'll be admitted to the hospital, onto the hospital floor, and people will usually attach monitors. They'll draw labs. You'll be seen by multiple, at least one doctor, if not two or three, while you're in there. So, like I said, this is because they consider this to be a severe illness. Okay. Sometimes there's certain surgeries that need to be done, and they need to be done urgently. So, say that you come in and you can't tolerate any food or water, and maybe your gallbladder is bad. So if that's the case, then like I said, you may have to get your surgery done on an inpatient basis. So that's something that needs to be done, or certain intensive treatments have to be done in the hospital as well. And then some people may have some conditions where, you just need close monitoring. And like I said, for something that's unstable, yet again, that heart condition is one of those things, or maybe your electrolytes are really off and you need to be monitored. And so those are the type of things that qualify for a hospital admission. So while you're in there, of course, everybody's doing what they can to kind of, treat your underlying, whatever condition brought you in there, as well as keep an eye on other things. So you may come in and say, we're going to use the heart attack thing, the heart issue again. So you may be coming in for chest pain and we're trying to find out if you have a heart attack, but maybe you got diabetes, maybe you have high blood pressure. We still have to manage those while you're inside the hospital. So that has to be done. Now, but while you're in there, remember, you're not in your regular state. You're not getting up. You're not making your own dinners. You're not moving around as much. Some people, like depending on if you come in, say with a broken leg or something of nature, you're not able to move yourself. So there are certain conditions that can develop while you're in the hospital. Now, not necessarily the cause of the hospital, but like I said, these because of your state, your state, these dangers are there. And so what are the risks that you have to be aware of? So there's things like infections. Remember, it's a hospital. There's sick people there. There are germs that are going around. So like I said, there's always a chance of acquiring an infection while you're there. Medication errors. Remember that, like I said, somebody may have 5 to 7 patients. So, they have to keep track of that, of everybody's medicine. So say that, you got 7 patients and they got 10 medications apiece, that's 70 medications. So you got to make sure, that is going on, that they're keeping track of that. And so there is a potential for medication errors. There's falls, you're in there, you're attached to, devices, you got an IV, you may have what they call a catheter, and you want to get up and go to the bathroom, or maybe you just want to get up and go to the chair. But like I said, because you're in a weakened state and you have all these things attached to you, there's a risk of falls. Another one is pressure ulcers, bed sores. So yet again, the example of maybe you have a fracture of your leg. Well, you can't really get up and move around. So like I said, there are the mechanisms in place that are supposed to keep you from laying on one area all the time. But if that doesn't happen, like I said, you can get what you call pressure ulcers or bed sores. And these can be, like I said, these can be pretty bad because they are sores. They can break down to ulcerations. And those things can get infected as well. So like I said, that's one thing that you have to be aware of while you're in the hospital. Blood clots are another big thing. Like yet again, you're not moving around. Certain conditions, depending on what it is, make you more prone to blood clots than you would be in a healthy state. So that is something else you have to be aware of. And like I said, and things that we have mechanisms and things we can do to try to minimize the blood clot. Of course, anytime you're going for any procedure ever, like I said, any procedure that you go for, there can be complications. So surgical complications can happen. There could be, of course, misdiagnosis or delayed diagnosis. People are trying to find out what's going on with you. Maybe it's not presenting itself well. And like I said, there's always the chance of that delayed diagnosis or misdiagnosis going on. The communication breakdowns between staff, like I said, that can also be an issue. One thing that I think a lot of people don't talk about a lot, and that is this condition called delirium. And what delirium is whenever you have an altered state. So you don't really know where you are. Might not even know who you are. And this can occur in certain conditions, especially like with infections. And for some older people, when they get in there, because it's a different environment, they can just become confused just in general. And they have a condition called sundowning. And so what can happen is that, they may be okay in the daytime, it gets dark, and then they all of a sudden become really confused overnight. And so that is something to be aware of as well. And then, of course, malnutrition or dehydration. Typically, this should be addressed because, like I said, most people will come in, they'll be attached to an IV, getting fluids. But say that a lot of our procedures, you can't eat or drink anything. And so while you're waiting for that procedure, so like I said, if this happens several days in a row, like I said, there is the risk of malnutrition. Also, when your body is trying to heal itself, sometimes it needs more nutrients than you may typically take in or that you have access to. So like I said, that issue of malnutrition is always something that can happen within the hospital. So I talked about some of the top 10 dangers or issues that can happen inside a hospital. So what can you do about this stuff? So for each one of those things, there's actually, specific things you can do. But the biggest thing is this, and that is, you want to be your own advocate. And this is, in the inside the hospital and outside the hospital, you want to be your own advocate. Because, like I said, yet again, at the end of the day, it is your body. You also have to consent for treatment and stuff of that nature. So you want to be your own advocate. You want to understand what's going on with your body, what the plan is, what's going on there. So the way you do this is you ask questions. So if somebody comes in and says, well, yeah, Mr. or Mrs. Jones, we think you have angina, and so we're going to do a stress test and echocardiogram. Okay, well, if you don't know what angina is, ask the question. Hey, doc, I'm not familiar with this word angina. What does that mean? Oh, well, this is a sign that your heart is not getting the blood flow and you're at risk of having a heart attack. Oh, okay, I understand. So you can ask questions and seek clarification about words that you may not know, and also treatments or that you may be receiving. So like I said, you're getting a stress test and an echocardiogram. Okay, well, that's interesting. What's a stress test? Okay, well, this is a particular procedure where we kind of stress your heart to see if you're at risk of having this heart attack. Okay, interesting. What's an echocardiogram? Well, it's an ultrasound of the heart, and we can see your heart when it's pumping and see if there's any irregularities. Okay, so that's how you ask questions, you seek clarifications, so you can understand what it is that that your healthcare team think is going on with you, and what procedures are they doing to clarify it and or to treat it. So those are the type of questions you want to ask. One of the things that can be helpful is actually to keep a notebook. So this could be either a written one, to get a pen and a pad, kind of old school. Or like I said, most people's smartphones have a little note area in there. And like I said, you can write down, who is treating you. Like I said, what's the name of the doc? What's the name of the nurse, nurse practitioners, PAs, all that stuff. Is there a social worker? You can keep that name in the book as well. And also the specialists that are coming in. Because the one thing that happens inside the hospital is that you may be seeing a lot of different people. So you may have, what they call an attending doctor that's over your care. They call them hospitalists nowadays. There may be, 2 or 3 consultants, and then whoever's with their team. So there may be a lot of people that are there. So a lot of times, you can't keep up with this stuff in your head. So, you just write it down. Like, hey, my main doctor is, this person. My heart doctor is this person. And that kind of helps you keep track of what's going on there. Okay. You can also keep a list of the medications. If you have a lot of medication, that may be a little hard, but you can do that as well. And any concerns. So like I said, if you're in there and you're concerned about bed sores because you've noticed you've been there for several hours and you notice your loved one is not turning different directions, then write that down. And when the nurse comes in, say, hey, I'm concerned about bed sores. Are we doing anything to kind of prevent that from happening? And like I said, if you have a notebook of your concerns, it's easy to remember, because if not, what happens is they come in, they're doing their thing, maybe checking vitals or giving meds or something else of that nature, and you forget about the concern you had. And then the next day goes around, like, oh my God, I forgot to remind them of that. So keeping a notebook is one way to do it. Another way you could do this also, a lot of hospitals and even clinics have these things called patient portals. And if you have the patient portals, it actually will help keep track of a lot of things. So when I was in here with my loved one, I got access to that. They gave me permission to get access to their health portal. And when they did that, I can see the medications. So when the nurse comes in with the medications, I could double check I could double check that, and I see, oh, okay, look, this person has these medications are the same, and it also helps you to clarify what's going on there. Of course, being your own advocate is great, but like I said, also bring a family member or friend as a support person. Two ears, 4 ears are better than two. And like I said, and two brains are better than one. So if you have somebody else in there, they can help with clarifying things. Depending on what it is, maybe you're a private person and you don't want somebody. But a lot of times when it comes to hospitalization, having somebody there for support is important. And honestly, when the doc comes in or the nurse comes in, you can ask that person to step out so you can have a private conversation. And then whenever you finish with that conversation, they can come in and they literally can be a support person. They don't have to actually know, what's going on with you and things of nature. They can just be there as a support person. But a lot of times it's important, not only from, minimizing things that are going on inside the hospital, but also for your own mental wellness. Also, you can ask that person to like I said, if you got questions, you can ask that person to write them down, and like I said, keep track of that as well. The other thing is know your rights as a patient. So you always want to know your rights. We're a country of law, so you have certain rights. You have to, number one, you have to consent to treatment. When you walk in that hospital, they're going to get you to sign a patient paper. You actually have to consent to everything that is being done to you in that hospital. Okay, so when they place the IV, you have to consent to it. When they give you medication, you have to consent to taking it. If they want to do procedures, you have to consent to this. You have to consent to all of this stuff. So that is one of the biggest things to know as a patient, is that we actually can't do anything to you unless you let us do this. So now if you're confused or something of nature, can't make your own decisions and we can't find anybody, we may do things to save your life in an emergent situation. But if you are conscious and able to make your own decision, then in those cases, we actually have to respect your rights as a patient to refuse treatment. And we also will explain to you, like I said, you refuse certain treatment, you're risking your own life. So you say, if you come, yet again, heart attack, you come in for a heart attack, the specialist comes in and says, hey, I think you need to have, what they call a heart catheterization, where you go in and open a blockage. You can say, no, I don't want that. I don't want that heart catheterization. Your specialist or cardiologist is probably going to tell you, well, you are at risk of death. You could say, yes, I understand that I'm at risk of death if I do not get this heart catheterization, but I do not want to have it done. And they can, try to treat you with medications, but you actually have the right to do that. Like I said, it may not be the most prudent thing, but like I said, if you're conscious and you're able to make your own decisions, you actually can do that. People, like I said, I've only had a few experiences where people have refused come to the hospital, refuse treatment, but I have seen it happen before. And yeah, most time it doesn't go very well. Also, like I said, the other thing is speaking up. You want to make sure you speak up. If something don't seem right, if you don't seem like you're getting better, or if you have certain concerns, hey, I want to make sure I don't get any blood clots. What are you all doing about that? And they'll be like, oh, well, we're doing X, Y, and Z. So speak up if something doesn't seem right. Address it with not only with your nurse, but also with the doctor as well. Make sure it's being addressed there. Okay. So that's being your own advocate, addressing issues inside the hospital. So say that you do have concerns. Who do you reach out to? So so you want to start with the nurse or the doctor. Those are the people that are hands-on, that are taking care of you, things of this nature. Okay, if things don't get addressed at that level, then you want to talk with what's called a charge nurse or a department manager. Charge nurse is over all the nurses on the floor. Department manager is over that department. So those two people are kind of more administrative, but they can address your issues if you have certain issues. Then you want to, if that doesn't work, the next level is what? Contact the hospital's patient advocates. Most hospitals are going to have what they call a patient advocate. That person's job is to talk with patients if they have concerns. It could be, you could say, hey, there's too much dust on the window. that patient advocate job is to address that. It could be, hey, I don't trust my doctor's diagnosis. Their job is to kind of advocate for you while you're in there. Okay, so that's the hospital's patient advocate. If it's still not resolved, you actually can reach out to hospital administration. So you look up the website. If there's a list of the hospital administration in there, you can actually, they usually will have a email address, or you can call the operator and get a way to contact them. You literally can reach out to that level if you need to, if these other avenues are not addressing your issue. And then with their serious issues, you actually can contact state health departments or accreditation organizations to resolve more serious issues. So you do have a way to address things. Like I said, usually the best way to do it is stepwise, by starting with the people that are taking care of you. And then, like I said, if issues still aren't addressed, then going to the next levels there. Okay. And then I'm going to wrap this up here, but like I said, one other thing you want to remember, and that is the importance of feedback. So one of the things that goes on, and like I said, I want to say this especially to African Americans. Okay. We are very passionate, and when things happen to us, a lot of times we'll talk about what's going on, and we might fuss out somebody. But the one thing that we have a tendency not to do, and that is to write our concerns. Um, and that is super important. So when you're out of the hospital, a lot of times they're going to send you a survey. And so when they send that survey, it is important that you fill that stuff out, say what you do like and what you don't like. If you had some bad experiences, write those down. If you had some great experiences, write those down as well, because this information goes back to that hospital, especially the hospital administration. And that's how they make changes in their service lines, and some of their, how they manage how they manage the hospital, is that you have to give that feedback. It's the written feedback. The verbal stuff may or may not go somewhere, but like once you put it on that paper, that stuff becomes important, and it becomes a lot easier for administrators to actually track and to make changes. Okay, and especially if it's one person, okay, one thing. But as if it's one person this week, two people next week, as that number of complaints or compliments adds up, like I said, that sends a signal back to the administration so that they can make changes that changes, or reinforce services that reinforce services that are good, or make changes where things may not be to your liking. So, okay. It also influences these feedbacks and surveys also influence the hospital ratings in some way, and sometimes the funding as well. And it also makes sure that your voice is heard, and it can lead to policy changes. This becomes extraordinarily important in what I call the community-based hospitals or local hospitals. Because if there's a hospital that's nearby, is able to manage you, like I said, a lot of times you're going to want to go to that one as opposed to going to a bigger hospital. But you may have a bad experience. But if you have a bad experience, write it down, fill out the survey, communicate with like I said, communicate with the administration there, so they can address that issue, make changes to make your hospital a lot better, so that because if they make that better, then the next time you can go there. And when you're there, like I said, family, it's easier for family to come in, friends to come in, and that stuff is crucial in your healing process. And yet again, for African Americans, it's just really important for us to address this in a systematic way. Yet again, yes, vocalizing is important. Sometimes you gotta, be passionate about your advocacy, but the written follow-up is instrumental in making the changes to these systems that make it better for us. So that's kind of the end of this this little presentation. In terms of other resources, there's a Patient Advocate Foundation. The Joint Commission actually can help with some of the advocacy stuff. Medicare.gov, Hospital Compare can also help with that as well. So I know this is a little bit longer, but I thought this is a very important issue that we need that has to be addressed. And hopefully you all found something useful out of this for the next time that you go to the hospital. All right. So as always, Brother Brown, any questions or concerns?
Okay, Dr. Brown, supposing your patient is not able to understand what these things that they can and will do. Who can next? They're too sick to do it. Who can get this information other than that patient?
Okay, that's a very
The
important question. So
someone that's in charge, can they request this information? But a lot of times they tell you they can't give you certain things.
correct. You're absolutely correct. And that's actually a very important question. So it's very important that you assign a person to act on your behalf whenever if you become really sick or you can't make decisions on your own. If you assign it ahead of time, then like I said, that person will be it. If you do not, if there's no person legally assigned for your health care and you're not able to make your own decisions. Then they go by a next of kin. So if you're married, your spouse can get that information.
Okay.
If you're not, and like I said, if your spouse is not available, then it goes to your kids. Okay. So your kids have to make a decision. If your kids are not available, then it goes to your parents if the parents are still alive. If the parents are not alive, then it goes to your siblings. So that's the order that they go through, and if for people to help make decisions in the event that you're not able to make decisions and you have not assigned someone to make those health decisions on your behalf. So that's how that process works. Okay.
But it's best that we get, I guess we put something in writing while we're able to.
Yes. So it's called a healthcare power of attorney. So so healthcare power of attorney. So assigning that is very important because that way, it's just known. Like I said, so when you come to the hospital, they will know that you have this healthcare power of attorney out there. That person knows. It helps the hospital know. They bring in that piece of paper. Yet again, it's paper. Like if you bring that piece of paper in there as a healthcare power of attorney, they have to they have to give you information. They have to talk with you. You get to make the decisions. So setting up a healthcare power of attorney is crucial to helping helping to assigning someone to act on your behalf. Because if not, like I said, we go through these other things, and like I said, maybe you don't want your spouse. I mean, you and your spouse maybe not legally divorced. So say that you're in a separation, like you've been separated for a year, and you no healthcare power of attorney, and because that's a little silly, but some people get separated and they start dating other people, and their true spouse may not like them anymore. If you didn't assign your girlfriend, boyfriend a healthcare power of attorney, then when it's time for a decision to be made, it goes back to your legal spouse.
That legal spouse can come in there.
That's it, and they can go in there and make any decision they want to make. If you're out of you're incapacitated, they can make your decision on your behalf. Now, if you sign that healthcare power of attorney and you give it to the boyfriend, girlfriend, then that person can come in and make decisions on your behalf. So, so that healthcare power of attorney gives you power whenever you can't make your own decisions. So you assign the person that you want making decisions on your behalf. Okay.
Thank you very much for good information on today.
All right.
Good information for the ones that will take and then use this information. Hopefully that the audience that heard you will use some of this information, and we won't have so many problems when you got someone that's sick.
Exactly.
The younger nurses, they seem to answer to do what you want them to do, but some of the older nurses are laid back in their ways, and they don't want to be questioned about what they do.
So so they're definitely different personalities. I think that's kind of all around, whether it's nurses, doctors, everybody else. It becomes very important that we like. So yet again, this is where that advocacy, self-advocacy. You want to ask those questions, make sure you're getting the things done that need to be done, and just ask respectfully. It's kind of hard for somebody to argue with respectful questions, even if they don't want to be questioned. If you ask respectfully, be polite. Like I said, that stuff goes a long way.
Thank you very much, Doc.
All right, thank you. Great questions, and I'll chat with you next week. All right, take care. All right. Bye bye.
WVOE 1590 AM.